Stokes.
Rosemary, Dr. Rosemary in the afternoon. As a matter of fact, Dr. Rosemary in the afternoon this week will be heard at 4:30 as you're listening now, and we will be eventually we're moving her to Saturday morning from 6:30 to 7 on WSBR, but just a couple of more times we're going to let you hear it in the afternoon. So Dr. Rosemary has a very important topic, something I frankly know very little about. It's called oral cancer. So welcome to the show, Dr. Rosemary.
Thank you, Anita. How are you doing today?
I'm really fine, and it's interesting you should bring that subject up because I never think of people with cancer in their mouth, and people never have told me, well, I've had cancer in my mouth. Would you tell us all about it, how it starts, how we know about it, what the tests are?
Yes. Oral cancer, like cancer anyplace else, starts because you have those cancer cells. And those cancer cells are those uncontrollable growth of the cells that they grow, they invade all the surrounding tissues. And it can occur any place in your body. It can occur in your mouth. It can occur in your throat. It can occur on your lips, on your tongues, all over. Oral cancer compromises, when we say oral cancer, it can include cancer of the lips, of the tongue, of the cheeks, the floor of the mouth, which is under your tongue, the roof of your mouth, the sinuses, your throat. All of that is considered a form of oral cancer. Oral cancer is usually not life-threatening, but if it's not diagnosed early enough, it can be life-threatening. So we say, who will diagnose oral cancer? Usually it's your dentist, because when you go to your dentist should do a thorough oral cancer screening. They should be looking in your mouth. They should be looking at your cheeks. They should be taking a gauze, lifting the tongue to the roof of your mouth, looking on the sides of your tongue, taking your tongue and looking on both sides of it, because that's usually where oral cancer is most prevalent, is in the back of the tongue, where people don't see it, and it grows as a little sore, and it just gets bigger and bigger.
So is it painful?
It's not painful. And it's like all other kinds of cancer. Cancer usually, what's the difference between benign cancer and malignant cancer? Usually malignant cancer, it's usually not painful.
So someone would know because they feel like they have a sore in the back of their mouth?
Usually they'll have some kind of sore that usually doesn't go away. Now, men are twice as likely as women of getting oral cancer, and it's usually over the age of 50. We're going to go over some of the risk factors for cancer, which fortunately or unfortunately are some of the risk factors for other types of cancer. Smoking, smokeless tobacco users, excessive use of alcohol, of course, family history of cancer, and excessive sun exposure. So all of these factors increase your risk to oral cancer, but we also know that these exact factors also increase your risk of other types of cancer.
Well, do you have people who you have examined and you've discovered oral cancer?
Yes. And fortunately, we have saved their lives.
So if they had not come to you and you had not examined that, they would have maybe it would have really gotten very bad. And how do you treat this, Dr.
Because
Rosemary?
what happens, Anita, is the cancer, like any other cancer, cancer is, it's the cancer cells that just grow and grow, and it can spread, so it's not confined to your mouth. Even though the cancer will start as a lesion in your mouth or in the roof of your mouth or the floor of your mouth or wherever it is, it will grow because it gets into your bloodstream and into the lymphatic system, and it starts to grow, and it can metastasize or spread to other organs. So cancer in your mouth, we have to remember that the mouth and the head and neck is not separated from the rest of the body. It's all attached. So as I always stress, the importance of oral hygiene and how your oral hygiene can affect the rest of your well-being, it's the same thing with oral cancer. Oral cancer can also spread to the rest of your body. It's not like, well, I have a little lesion. Okay, it's nothing. That can also, those cancer cells can invade the surrounding structures and can go ahead and spread into other parts of your body.
Is it very prevalent?
Luckily, it's not very prevalent. And I'll tell you probably the reason why is because it can be detected and it can be treated and removed in its entirety. When we do see oral cancer or we see something that is suspicious, you can remove it one of two ways. If it's something that is small and we can just remove it with a biopsy that you don't even need anesthesia for. We just remove some of the cells from the surface, send it to the lab. They'll biopsy it, and we'll see. If it looks something that might look a little bit more suspicious, we might remove more of the lesion, even in its entirety, and take that. That, of course, you would need a little bit of anesthesia for. And then once it's removed, if, you get all the borders around it and, it's one of its early stages, then it's removed in its entirety. You don't need any chemotherapy. You don't need radiation. You don't need anything like that. And then, we just monitor it. And, of course, most of the time, 90% of the time, somebody who has oral cancer has one of the risk factors. They're smoking or using smokeless tobacco. And, once they have this type of a cancer, they usually will change their habits quite quickly.
I would say so.
Yeah, they're very quick to go ahead and change their entire lifestyle. So oral cancer, and even now medical doctors are really now starting to look inside patients' mouths, and they're examining the floor of the mouth, their throats. So really, you really want, even if you don't see a dentist regularly, when you go to your physician, you want your physician to take a look because they have the light that can look in your throat, they can look at the sides of your tongue, they can look at the roof of your mouth. You really want to get a thorough examination because it really starts as a small, tiny little lesion. It can be a swelling, it can be a bump or a rough spot, it can be on your lips, on your gums, somewhere inside the mouth that you may not even see. It can be on the lips. It can be even outside the lips. That's why sun exposure is related to oral cancer because you can have a little tiny lesion on the outside of your lip, on the corner of your lip. So sun exposure is very, very important to oral cancer.
Because I was going to ask you that, in a sense, that once you have that, is it going to come back? I mean, if you don't do any of those other things, what keeps it from coming back? I guess like any other cancer.
It's like any other cancer. You really have to follow, good preventative measures. You have to constantly be rechecked for it so it doesn't come back. But once you have it, it's like any other cancer.
Well, I was thinking that something that you told us you would do last week, and this is even more critical for people to come in now. Dr. Rosemary is very kind, and she knows there are people who probably haven't gone to the dentist, and she really wants to make a wonderful offer. She wants to offer you a free consultation to come in and see her, and of course she'll do the oral cancer screening while she's looking at your tongue and there to check to see if you have a problem. And on top of that, she's going to do a free examination of all your teeth and your gums, and then she's going to give you free x-rays. Now, you know that all this costs money, but she's going to offer this free as a compliment because she really appreciates the people who listen to our show, and we appreciate her. And there's a value of about $250. So we are very excited about this, and all you have to do is call this number. Remember, this is Pencil Talk Radio. Get your pencils out and a notebook, better than little pieces of paper, and it's 954-489-1345. 954-489-1345. The Adult and Geriatric Medical Center is a very special place because they have many of the medical practitioners, and of course they have Dr. Rosemary there. So thank you, Dr. Rosemary, for allowing people to come in and get this done. And of course, some people now are as amazed as I. I mean, I really haven't known much about oral cancer. You don't read much about it.
No, it's not. You don't read a lot about it because luckily it's not so common. And, sometimes, Anita, unfortunately, it doesn't really get diagnosed. It really doesn't get diagnosed. And people can live with it for many, many years. Sometimes, unfortunately, and I've seen a few cases like this, sometimes by the time it is diagnosed, it has invaded not only the underlying tissue, but it's also invaded the bone.
Oh, my
And,
goodness.
that's why sometimes the treatment does involve many different, it's really a multidisciplinary approach to treat oral cancer. Why? Because you not only have the surgeon involved, you not only have a oncologist involved who treats the cancer, but you have a dentist involved who then maybe can give you new teeth in that area, but you have a nutritionist involved who's going to give you the proper diet of what you need, but you also need a rehabilitation specialist, because when you have cancer, let's say in the back of your mouth, that has now invaded part of your mandible or part of your lower, let's say your jawbone, which I have seen this a few times. What happens is, to remove it, sometimes people have lost their jawbone. I just saw a patient like this yesterday who came to see the medical doctor. And the doctor had then called me to go down, and this patient had cancer of his jawbone. And by the time it was diagnosed, it was so late, so he had part of his jawbone removed. And now he's in the process of getting a prosthesis made for his mouth, because a denture won't work. So he has to have a special prosthesis made that he'll be able to speak properly again, and he'll be able to function and eat properly again.
Oh, my heavens. I am just in awe of this conversation, Dr. Rosemary. That's very, very serious. And, when you think of it, even though it's serious if it's on you have skin cancer, you have lung cancer, of course it's serious, but somehow, I don't know why I feel in your mouth, how do you eat? Everything happens from your mouth.
Yeah, that's why we're doing this radio show, Anita, so we can give more attention and let people really be aware of their mouth and let them know about the things that go on in their mouth. Because, people feel, well, as long as I have no pain, everything's okay. It's not bothering me. Why fix it? But really, there's so many things that could be going on in your mouth. From, like we said, from the littlest toothache, which later on can turn into a fractured tooth, which could turn into a root canal, can turn into, major work, to a little lesion, which may, God willing, be nothing, or may turn out to be cancer. So really, it's really important for people to understand that the mouth is part of your body. It's a very important part of your body, and it really does deserve attention. And if you care for it, it will take care of you. So that's really very important. That's why we're doing this show, just so people are aware of it, because unfortunately people really aren't aware of it until sometimes it's too late.
Yes, that's so true, and especially, I don't know why, it's the oral cavity, which we've talked so much about people with bad breath and why they're having bad breath, and they have all sorts of diseased gums, and you wonder why they're doing that. It must be education. Do they educate children in school on dental health?
Yes. Yes, we do. We have dentists who go into schools, and they go and they teach children how to brush. We give children toothbrushes. Now there's such a big push with children in school, especially about obesity and healthy eating. They're revamping all the school lunches, and really just such a big push onto all just children's health, a whole makeover that really children, even their oral hygiene now, children flossing, and children just are not getting as many cavities because of the fluoridation in the water. Children are going to the dentist now when they're younger for the checkups. So really, when we were children, probably there was more decay, was more prevalent. But now kids are really getting access to oral health care. They're coming in, they're getting their checkups, they're getting their fluoride treatments regularly. Hopefully they are brushing at home. A parent is watching them and encouraging them to brush properly, not to eat as much candy. Again, not to have as much sugar and sodas. Again, we are encouraging kids to stay away from the junk food that years ago I think people just had so regularly. It just was like second nature to drink soda instead of water. Now you don't see that as much.
That's true. And, of course, we still have Halloween, but that's a big treat where the children get their bags of candy and they start eating it all. But you're right. They just do that a little bit. But I want to get back to the whole issue of oral cancer. You said that, I think you said, this is hereditary?
It's if you have a family history of it, you can be more likely to get it. Like other cancers are also, like colon cancer, breast cancer. If you have a family history of somebody with cancer, you can be more likely to get it. So, of course, they recommend the testing for it. So if you know somebody in your family that had oral cancer, you definitely want to tell that to your dentist when you go for your checkup. And you also want to tell your medical doctor that because you want to get a little bit more of a thorough examination and you want to make sure you have nothing going on.
Of course, when you think about it, having a colonoscopy is a much bigger deal than having Dr. Rosemary examine your tongue.
Absolutely. Exactly. It's nothing. There's no preparation involved for that.
That's right, and you just see it. Well, so is it possible, I'm just going to ask you this, when you have x-rays, which we have when we go to the dentist, is there any way that can hurt somebody?
No, because the x-rays, nowadays most dentists are doing digital x-rays. And the digital x-rays give so little radiation, and radiation is not one of the risk factors for oral cancer. So you're really not getting the oral cancer from radiation. So it's not harmful at all.
Okay, that's reassuring because now I'm saying, oh my goodness, I hadn't even thought about that until we're just talking. All right, so we have some very good points here. That the most important thing is if you haven't been to the dentist, you need to go to one. But even if you've been to one, and maybe it's in between the 6 months or the year, if you have something, and it's usually under your tongue, or is it ever on your tongue?
What I'm going to do, Anita, since this is Pencil Talk Radio, I'm going to give some of the symptoms of oral cancer, which people can listen for if they have any of these or they know somebody who has any of them. This is something that needs to get attended to.
Okay. I'm writing it down.
Any kind of velvety white or any kind of red patch in your mouth that it doesn't go away. Something that doesn't heal, like a persistent sore on your face, on your neck, in your mouth, anything like that, you want to have that attended to. You want to have your dentist, you want to have your medical doctor, you want someone to look at that. If you have a little canker sore, which is another kind of sore that you can have in your mouth. Right. But a canker sore will eventually go away. Maybe after a few days, maybe after a week, but a cancerous lesion will not go away.
Wow. Okay, I'm writing all this down because I'll bet there's some people listening now that maybe have a canker sore and they're worried that maybe that's a cancer cell.
Right. Any kind of unexplained bleeding in the mouth. If you have this sore that could be bleeding, anything like this wants to be attended, or any kind of unexplained numbness. Now, if you go to the dentist sometime and you get an injection for an extraction or for a filling, sometimes you can be numb for a couple of hours. Sometimes you can even be numb for a day. That is not considered unexplained numbness. But if that numbness, if you have not gone to the dentist and you are numb for no apparent reason, that you want to go and you want to get that checked out.
Okay, then, numbness.
Yeah, any kind of numbness. If you have anything like in your throat, if in the back of your throat you feel like you have any kind of sore there, like you have difficulty swallowing, not like a sore throat, but you feel like you have something stuck. You know when you swallow sometimes the candy or the food goes down the wrong pipe or something, you feel like something is stuck, lodged in the back of your throat? If you have that kind of a feeling, that's maybe causing a change in your voice or this persistent sore throat, that's something you also would like to go and get checked out.
Okay, I've got that written down.
Then any kind of dramatic weight loss. And again, dramatic weight loss is something that you always want to get checked out, not only for oral cancer, but any kind of cancer. You know, really any kind of sudden weight loss is something that should always be attended to by your physician right away. Because that's, you know, really sometimes one of the telltale signs of cancer or something going on. And this is if you're not trying to. Of course, if you're on Weight Watchers or Jenny Craig or something and you're trying to lose weight, that's different. But if you're not trying to lose weight and all of a sudden you're losing a lot of weight, then that's something, you know, you really want to have attended to.
Okay.
Then also changes in the way your dentures fit. If your dentures fit you fine, and then all of a sudden now they're not fitting you, and you have not lost weight, or you gain weight, or something happens, and all of a sudden your dentures don't feel like they're fitting anymore. That's something you'd want to go to your dentist for, because that could be a lesion, or there could be a cyst or something growing in there that's causing your dentures not to fit.
And I've written all this down. These are amazing. You know, Dr. Rosemary, I have had a lot of radio shows over the years, as you know, and I've written a lot of articles. I've had articles written. I don't think I've ever had anything like this. This is so extraordinary and exceptional that you're doing this. I love having you tell everyone these things, because we could be saving someone's life right now while someone's listening.
Yeah, that's what we hope we're doing, because it's important for people to just be aware of this, because people don't realize this. They may say, oh, my dentures don't fit anymore, and they may not think anything of it. And God willing, Anita, it won't be anything serious. But, you know, if it is something serious, why not be aware of it? Why just be sitting home thinking it's nothing when it may be something? Knowledge is power.
Yes, and having a very good dentist is power, too. So Dr. Rosemary, in the afternoon, at the moment, we're going to move it to Dr. Rosemary in the morning, but right now it's Dr. Rosemary in the afternoon, and I hope that you will make that phone call. This is such an exciting offer that she has made, and she really does it from the kindness of her heart. She's a very special woman, and I hope that you will get to meet her. Call her at 954-489-1345. That's 954-489-1345, and this is the offer. If you call, the first 20 callers will get free consultation. You'll get a free examination, an oral examination. Of course, then that would cover the oral cancer screening. And then you'll get free x-rays just to make sure that everything is right. And there's really no obligation. I mean, this is a very wonderful offer made by Dr. Rosemary, and she is in with the Adult and Geriatric Medical Center group. They're located on Commercial Boulevard in Fort Lauderdale. So we didn't talk about age on oral cancer. Can this happen to a young person?
It usually occurs in about 50 years and older, but it can happen to somebody younger. Yes, of course it can.
So that's... Now, when people come in and they've had this cancer, what, other than just not smoking and some of the other things that you said, is there any other kind of prevention that they should do? I mean, I guess they should go every 6 months and have someone check it, because... Every 6 months. They should come in, have a thorough examination, and really whatever risk factors, providing there was a risk factor there that caused the cancer that we know of, that should be stopped immediately. If there was no risk factor and it was just idiopathic and they just happened to have gotten the cancer, then there's nothing we can do about that. And you do know, you hear of people that have gotten lung cancer and they've never been exposed to asbestos. They never smoked a day in their life. They never had a drink of alcohol a day in their life. You know, those kind of things, unfortunately, do happen, and there's nothing really you can do about that. But, again, just by continuing to go and get preventative checks every 6 months is really the best maintenance possible. And I just want to repeat some of these. I was very excited to write this down. If these are some of the ways that you can tell if you have something wrong with your mouth, whether it's cancer or maybe something else, but it's a velvety, just you have to correct me if I see how I'm doing. Velvety white or red patches, something like that on your tongue. If it and
or
it
anywhere in your mouth.
Oh, anywhere in your mouth, and it doesn't go away, right?
Right. It can be in your cheek. It can be on the floor in your mouth. Anywhere in your mouth.
Okay. Or if you have unexplained bleeding, where you haven't cut your mouth, anything in your mouth, or it's not your gums bleeding. It isn't gums bleeding, right? It's really...
No, it's not gums bleeding. It's just any place you can have something in your mouth bleeding.
And then if you have unexplained numbness, not the one after you've had your teeth taken care of and maybe you've had some anesthesia, but if there's if there's unexplained numbness in your mouth, or is that on your tongue?
Right. No, unexplained numbness in your mouth. It can be in your tongue. It can just be unexplained numbness any place. Like yesterday I had a patient, and she said that she was having this burning sensation in her mouth, and her tongue felt on fire, and her teeth just felt like all the nerve edges were just burning, and she couldn't, like, she felt all her nerves were exposed. Now, there was clearly nothing wrong. I mean, I looked at her, she felt her gums were all red. Her gums were not red. Everything felt fine. Everything looked fine. I did an exam. There was nothing that I could see. So I referred her to the neurologist at our office.
Oh.
Because I said this might be some sort of neuralgia. I could not see anything that looked to me that would be causing this sort of pain. So she was so thrilled because right after she saw me and got her dental treatment, she went to see the neurologist and was, going to be treated, hopefully, for whatever this feeling she was, because it wakes me up in the middle of the night. All of a sudden, I'll feel like my mouth is on fire, like there's some sort of pain. So
that's
something
right. Unexplained, and it was so good that you had the neurologist right there in your center, that she didn't have to go somewhere else. And of course, that's a good story, Dr. Rosemary. I like that very much.
Yeah.
All right. Some of the other things that I just heard Dr. Rosemary talk about was, of course, in the back of the throat, if you're having difficulty swallowing. This isn't just from something, maybe you coughed up something and it hurt, but if you're having difficulty swallowing, get it checked out. And also any weight loss that we all want to lose weight, but if this wasn't something you've been working on and all of a sudden you're losing weight, that's important, because I guess that's what cancer can do for you. And then are there any way that changes in your dentures, the way they fit, and for no reason, right?
Absolutely.
So how did I do? I got them down.
You did perfect. You got them all.
Well, I only hope I never have oral cancer. Have you discovered patients who just come in for a typical dental exam, and you've discovered it for them?
Yes.
Amazing.
Yes. I'm practicing for 18 years. So in 18 years, you find it. Luckily, we don't find too many of them, especially in the very advanced cases. We find usually in the preliminary, in the very early stages. So what we can do is we can just remove the whole lesion, and then, it goes away. And hopefully we not only save somebody's life from the oral cancer, but by them stopping smoking and their vices, then, hopefully they don't get lung cancer, they don't get other cancers, because oral cancer usually is just the tip of the iceberg. Really, it's when it metastasizes that really can be life-threatening.
Right. Well, Dr. Rosemary, as usual, we learned so much from you, and I hope that people will realize you want good dental care that's affordable, and with this charming woman who is an excellent dentist, call 954-489-1345, and remember, the first 20 callers will be getting a value of $250 worth of a free consultation, a free examination, free x-rays, and the best of all, you get to meet Dr. Rosemary. Thank you very much, Dr. Rosemary.
Thank you, Anita. Have a great day.
You too. Bye.